Hello and good evening. Finally, you can hear me. Good. I'm so happy. Yes, thank you. Technology. I love technology. This is it. Wow. We have four beautiful faces. Actually, three. I count of myself too. But anyhow, as you know, this is Amir Laheji. I'm Amir from Los Angeles. So we are going to New York. We are going to downtown Los Angeles, and we are going to somewhere around here in the corner. So I know you're talking. So let's connect with Dr. Saif. Hello and good evening.
Good evening, Amir. Good evening, everyone. Sorry about the technology issues here. But
No problem, no problem. We are going to downtown Los Angeles and Nilufar. Hello.
Hello, Amir John. Hello, doctor, and hello to everybody. Hope you had a wonderful day.
Yes. Please look at the camera.
Having a good time.
Look at me. Look at the camera, please. I like to have an eye contact.
I don't know why. Is it like my problem? But I
No.
don't have your visual. I don't have the video.
My audio. My
video is paused for me.
Oh, okay. For now, everything looks okay. However, after 5-6 in Los Angeles, we have a very, very bad internet connection. So, just Dr. Saif.
That's the problem.
Yeah. Dr. Saif is here, and we are cut to.
Okay,
hi, Dr. Saif.
How are you?
Hi, doctor. How are you?
Okay,
I'm good. I'm glad
Dr. Saif, could you please just adjust your angle a little, tilt down? We can have you in the. Okay,
this way. It's better.
It's a little better. If can you hear? Can you see yourself
you want
or
it more
no?
Tilted.
Yeah,
I can see
up.
myself. Yes.
Go up.
Up.
Yep. Yeah. More.
Okay.
A little more. Perfecto.
Okay.
And in the center, please come to the center. Very good. Beautiful. So, live from Los Angeles, everything is live. This is it. Yeah, exactly. So we are going to New York because I heard a lot of news about corona virus, and I don't know which one is true, which one is not true, and I'm super confused. And we have a specialist. That's why we are going to New York to see what's going on in New York. And hello and good evening.
Hi, Amirjan, and hope everything is great. Thank you for having me tonight.
It's pleasure.
And because here is 9 p.m. and New York is going to a plateau, fortunately, after a very bad crisis that we had here in past few weeks.
Mm-hmm.
Gradually, we are going to a plateau. Like when we go good numbers, we have good numbers or plateau. I'm talking about 5,000 patients per day. And we are happy if we have 5,000 patients per day in one city. We are so happy, and we are celebrating for it. And I see that every day we use less ICUs because we have so many ICUs now. Now we are using less ICUs. They have built, I think, 8-9 extra ICUs to manage these patients, and now here and there they already started to close the ICUs. But I see the whole country, mainly in Los Angeles, I see that still is rising and is going toward the plateau in maybe next 20 days.
I'm very confused with the news. Sometimes they said, yeah, we're going to open, the businesses, and people, they doing it, they're reacting. Looks like everything is okay. Is it okay? Everything is okay, doctor?
The reality in the field will push them to accept it finally. I understand them because of the financial effect of the virus. I understand them. I really understand them. But unfortunately, this virus doesn't understand. And you know that some talented virologists, they found out that the whole universe has been impacted by a number of viruses, that the total weight of all of them altogether is 5 gram. And
Yes.
this 5 gram virus has impacted the life of 5 billion people. It means that for each 1 billion person, there is just 1 gram virus. And this is really
Scary, right?
surprising to me.
It's a
Yeah, it's a
serious.
scary. 1 gram for 1 billion. Each
Yeah.
1 gram virus covers 1 billion people. And this is a so meaningful concept for me.
So we have Nilufar from downtown Los Angeles, Dr. Saif from Los Angeles, and
So, doctor, I
oh,
want to ask you. I mean, it's sorry, Amir. I'm just going to
go ahead,
interject
please.
here about this. I mean, obviously, you're in New York. Can you tell us a little bit about how it has affected you? I mean, the New York you knew before coronavirus versus the New York you know today. What has been the astonishing thing from this 5 gram or the 1 gram that came to New York, perhaps, that you've experienced?
It's a life-changing experience, even for doctors. It's really, we don't feel that courageous. Sometimes we fight with this virus, but when we see the effect of it and we see the numbers, that the effect that it has on the medical staff, we are really concerning, but we need to fight with it. Someone has to take responsibility for it, and we have to do it, and we like to do it, but it's really a different, tough situation. I have never experienced such a thing. I have never seen such a aggressive virus. I have seen so many viruses. This is really is not comparable to any of them. But
Yeah, you're absolutely
uh,
correct.
yeah.
So how are you, sorry, and how are you seeing your patients now differently? I mean, how are you geared up when you're seeing your patient? And if you can talk about that a little bit. And also tell me if you feel comfortable going back to the normal that they're suggesting we should be doing in a few weeks. How's your comfort zone about that?
You mean that? Would you explain it more? What's the
Sure. Like, first
question?
of all, like, how do you see your patients now, and what are you going to do when you see your patients in the next few weeks? And then also, when you're going out now in New York, are you going to be comfortable when things are going to open up in a few weeks? Do you feel comfortable, or do you feel like you still need to take precaution for the months to come?
Oh, from now on, forever, we our lifestyle will be changed, because first of all, besides COVID, we don't know when we have another mutation like COVID-21, God forbidden COVID-21, or hantavirus. We had it a few years back in Yosemite, or other viruses like dengue fever, Zika, and there are so many others in the row. And as you see, just one mutation has destroyed the whole world, and we don't know when it's going to be in the next one, how we have mutations in next flu viruses and other things. Then we need to start to get used to this new life, and for sure it's going to be some improvement in next few months, but I'm sure that we never come back to the normal that we were thinking and we used to be there, our baseline. We don't come back to that baseline, and you're going to be always careful, and it's not too scary. It's going to come, and we're going to conquer it sooner or later. And
Right.
I'm guessing before we do anything, any of these medication that we are using, and none of them has been approved, and we know that vaccination will be available at least in next 18 months.
It's very
But
good
before
news,
that
right?
time, I'm sure
18
that
months.
the body will
Come,
be changed. Yeah.
doctor, 18 months? Come
18
on.
Yeah,
Okay.
yeah, because as Bill Gates told us, there is no vaccine that has been built less than 18 months. And I'm going to tell you what's the reason after you finish.
My question is, yesterday I heard something. There is some medication and is affected so good. Is it true? It works very well. Is it
Today's
true or
name is
not?
remdesivir. Yeah, it's remdesivir. We are using it. Um, it's it's difficult to say that it's really effective or no. Like hydroxychloroquine, the whole world is using it, and president talked about it, and in Arizona it was interesting. One old couple, the elderly couple, they had one fish tank, and they used the chloroquine phosphate that they use it for cleaning that, and they eat it because they heard that, oh, chloroquine is good, and they ate that chloroquine phosphate. And it's a real story in Arizona. Yeah, there are so many things happens, but because the speed of the event is too fast, even we cannot process the information. We cannot process the millions of information that comes. But remdesivir, you're going to hear it soon as a medication that will be approved in next few, maybe 2 weeks or 3 weeks. They're going to inform the whole world that, oh, there is a new medication. But this remdesivir is a very well-known medication. We already used to it when we were managing Ebola virus. And it was good in Ebola, but in this virus, really is very invasive. And I don't appreciate the fact that they are working to open the public places, or it doesn't work. Really, it doesn't work, and it's really dangerous thing. I understand the concept. I understand the pressure that is on these people, but it really doesn't work. And I think that especially in states like California, you're going to see that they cannot, because now we just started this steep, and I'm sure that you are checking on a daily basis. You see the numbers, and you see that how progressively increasing, and I don't think that they can do those promises.
So, doctor, your point is that you think it's really premature that they're going to be starting public places and opening up, public places again. That's good to know. And the other point is, do you think heat or getting into the summer is going to have any positive effect on this? I mean, I'm kind of comparing it to SARS, H1N1.
I don't know, for some reason, WHO insisting that there is no effect of summer on the virus, but there are 4 reasons that we know that there is effect of summer on the virus. First of all, the coronavirus is like rhinovirus, that we know it for regular common cold. And for getting this virus, the temperature of the nostrils of the nose should be around 35 degrees of centigrade. And absolutely, that's the first reason that if the temperature is warmer, for sure you are more protected. Another thing is that we know that this virus is very sensitive to heat, and this virus really loves cold. You know that it can be in freezer for months. Wow. But in 60 degrees centigrade, immediately it destroyed. It gets destroyed. Then that's another reason that I have. And the third reason is in summer there is less people are out, and they are not inside the places. They are going outside, and in outside there is less concentration of virus, because that's another fact that people don't pay attention at. Like, people have masks everywhere. I like it and I appreciate it, but having masks outside, I don't want to tell that people don't do it. Is for sure do it, but the virus is not concentrated outside, and we know the initiation of disease is associated with the number of viruses that goes inside the body. Then if someone walks in the street, there is much less chance of receiving that volume of virus comparing to the closed areas.
Yeah, that's a great point. So the viral load makes a huge difference, which I think is important for people to be aware of, that's going to make a difference. And what about SARS? I mean, when SARS came, it was very short. It came, it was gone, and we didn't see it. Can we be at all hopeful that this might be the case with coronavirus? What are your thoughts about that?
Yeah, SARS is a step brother of this one. You know that the coronavirus, they have 7 members. And it's interesting. The person, a female doctor that found it out in first time they she showed it and she found it out in St. Thomas Hospital in London. And it was the same hospital that a few days back Boris Johnson was admitted there. And even he might not know about it. But this virus was found out there. And since that time, it has 7 members, 6 before COVID and 4 original ones. And SARS was the 4th one. MERS was the 5th one, and COVID-19 is the 6th one. And I got your point about you want to compare it with SARS, but it's not comparable as far as the level of destruction, because as you might know, the number of deaths in SARS just was 770 people. And as you see, this
Right.
virus is by far much more aggressive than that. And SARS got contained shortly, but I don't see that in next few weeks, at least, they cannot manage it.
Yeah. So unfortunate. So unfortunate.
Yes.
Yeah, and I wish I could give
But I mean, we
news,
cannot
good
be
news.
hopeful.
Yeah, I
Right.
wish I can be, but sometimes I feel, you know, when I interview with different TVs or places, they tell me, "Oh, give good news to people. People really need good news." Unfortunately,
No, you
Mr.
need to
Laiji
be, yeah,
never
Yeah,
pushed me.
truth.
You know,
Yeah,
because you know
truthful. I
sometimes
think being
yes.
it's
truthful is the
not good
best.
when you, yeah, and especially when you are dealing with something real, you cannot do this kind of things that people don't feel bad. Okay, sometimes we need to feel bad. We need to watch more. We need to see the real
This is
level of the
reality. This is
danger. We
reality.
shouldn't,
We need to know it.
underestimate it. Yes, it's really dangerous. I don't
Sure.
like the idea, and it's okay. Sometimes you feel scared. It's normal feeling, and we should be
Absolutely.
scared. I'm
Absolutely.
scared.
It's a
I'm
normal
scared.
human
I'm
reaction.
dealing with
Of
these people
course.
on daily basis,
Well, good for you. I mean, you're a
and I
hero. I
wish
mean,
I
for
can.
people who are, in the front line and doing this, I mean, my hat is off to you and people like you who are seeing these patients and are trying to help them. And thank God for that. And a lot of people are doing this every day. And it can be very, dangerous. And as you said, I'm sure you have fear every day you go in, but yet you have your duty. And as you said, it's a normal feeling we all have that this uncertainty of time is going to make us nervous. But I'm so glad that you're talking about it in a truthful manner and not sugarcoating this, because it's important to give the right information to the people. And I see that's what you're doing. And thank you.
Thank you.
In
Thank you so.
future, I'm
Yeah.
gonna give you good news, and I'm gonna inform you about anything. You know, I just described the situation, and people needs to make decision about it, and think that, oh, what they have to do. I don't want it to you use the best word. I don't want to sugarcoat things, because I realize when you underestimate the damage, the danger, then you make people confused, and you put them in jeopardy. It's not nice. It's not
Absolutely.
ethical.
Yeah, absolutely. Thank you so
Absolutely.
much. That's why we have Dr. Karandish from New York to update us with the all real news and what's going on over there, because he's dealing day by day and he knows everything update. And thank you so much for your time. Nilufar, do you have any question? Or you got your answers?
No,
Okay,
I got
okay.
all the answers. It was very helpful. Thank you so much, and I appreciate all the effort that you put into this matter.
And Dr. Saif?
Thank you.
Yeah,
Thank you.
just Doctor, thank you again for being here. Just one last question. So, what would you do in the next months? I'm sure people are asking themselves. So, what does it mean for me if I were to, summer is coming, events are coming to be coming? What would you advise them? I mean, I'm sure people are not questioning this. As government, as you said, it's a confusing time.
First,
As Amir said, people are
Good
saying,
question.
go out, start reliving, and then you're saying that this is not going away. So, as a doctor, as somebody who's seeing this every day, what would you advise people?
first of all, I'm advising to go for shopping just in early mornings, because we know that virus can stay in the air for 3 hours and more. then it's the best
Yes.
thing that you go as early as possible for shopping. And if you know anyone that has air condition inside the store, ask them to turn off the air condition, please, and just open the windows. Or even air conditions is open is okay. Just is working is okay. Just open the windows and open the doors at the same time. It's very helpful. And using mops for cleaning the floors, because you don't want to make those things from the ground comes inside the air. Then it's better to mopping the floors and not just brooming, using the brooms. And another thing is just making sure that you keep the social distance, physical distance with other people. And the same thing that I think all people know about it, but um, all people should be use it, and mainly using masks are very important. It has been proved that if 100% of people in a community use masks, they can reduce the level of infection to 80% lower. It's very important, but
That's
everyone should
amazing.
have it, because this mask that you use it doesn't protect you, protects other people. The low level masks that people make it with their shirts or other things, it doesn't cover them, covers other people, because
Yes.
virus is smaller than that. It can pass those things. It has like
Sure.
maximum has 50% protection. But if everyone has it, now it's very good, because it's no there is no virus from in goes out, and it's helpful for everyone. But if some people have used masks and
Sure.
some people don't use masks, it's not good strategy.
Unfortunately, in Los Angeles, I saw, today is like that. Some people they don't use masks, and it's going. Looks like is the number going more. Don't use mask, but it's very dangerous. That's why
It
I
It's
is.
called you.
mandatory.
Yeah, that's why I called you, to have you here from New York to update with the update news, especially about that medication. Thank you so much, and I hope to talk to you again. Anytime you got something, please text me. We're gonna have you on air very soon. Okay?
Thank you so
Sure,
much.
sure.
It was
Thank
a
Thank
you.
pleasure
you.
having you on
Thank
the
you so
Sure.
show.
Thank
much.
Be
you.
safe. Be safe. Bye
Sure.
bye.
Thank you. Have a
Take
good
care.
Be
night.
Be
safe.
You
safe.
Bye
too.
bye.